Did you know that liver damage can often go undetected until it's too late? That's why it's crucial to recognize the warning signs and take action early. Liver performs over 500 vital functions. Liver is our body's detox powerhouse, which is responsible for filtering out toxins, assisting digestion, and performing a variety of other crucial activities. Remember that it is more than simply a toxin filtration system. It also helps with food metabolism, bile production for fat digestion, and blood coagulation regulation. In this video, I will share with you 10 silent warning signs of liver damage that you should never ignore. Some of these symptoms will undoubtedly surprise you. Understanding these symptoms is critical for early intervention. Let's look at the warning signs of liver damage you should be aware of. Sign number 1. Fatigue and weakness. We often felt ourselves tired. I am not talking about the usual tiredness that comes after a busy day or a poor night's sleep. But this is about a deep, unrelenting fatigue that doesn't get better with rest, a kind of exhaustion that seems to take over your entire body, making even simple tasks feel difficult. Fatigue caused by liver disease is believed to come from the liver's impaired ability to detoxify the blood. When the liver is not functioning properly, toxins can accumulate in the bloodstream, causing abnormalities in brain function and energy levels. This can make you feel constantly tired, regardless of how much sleep you get. This persistent fatigue could be one of the earliest signs of liver damage. Sign number 2. Difficulty with night vision. Recall a recent evening when you might have struggled more than usual to see in low light or darkness. Maybe you have noticed yourself squinting or needing more light to read at night than usual. This isn't just a matter of your eyes adjusting slower than usual. It's becoming a consistent challenge to see clearly in low light conditions. This difficulty with night vision can surprisingly be a sign of liver issues. The liver's role in processing vitamins and minerals is crucial, including vitamin A, which is vital for maintaining healthy vision, especially in low light conditions. Sign number 3. Swollen right foot or ankle. Have you recently noticed that your shoes get tighter by the end of the day, particularly around your right foot or ankle? Maybe you've noticed that the swelling is more visible on one side than the other, and pressing on the swelled area produces a significant indentation that wasn't there before. This swelling, particularly when it's more noticeable on the right side, can be a subtle but revealing symptom of liver disease. The liver's health directly impacts blood flow throughout the body, including the circulation in your lower extremities. When the liver is struggling, such as with fatty liver disease or cirrhosis, pressure can build up in the portal vein, the main vein that transports blood from the digestive organs to the liver. This pressure can cause fluid to flow from blood vessels into surrounding tissues, resulting in edema or swelling, especially in the legs and feet. Sign number 4. White eyelid growths. Now, let's shift our focus towards a more visual and perhaps unexpected sign. Have you ever noticed small, white or yellowish bumps on or around your eyelids? These aren't just ordinary skin blemishes. They're called xanthelasmas, tiny collections of cholesterol under the skin. While they may seem harmless at first glance, xanthelasmas can be an external marker of deeper internal issues, specifically relating to liver health. The liver plays a pivotal role in regulating cholesterol levels in the body. When liver function is compromised, as seen in conditions like fatty liver disease or cirrhosis, it can struggle to manage cholesterol effectively. This imbalance can lead to the accumulation of cholesterol in various parts of the body, including beneath the skin around your eyes. Xanthelasmas are not painful or harmful in themselves, but their presence can be a visual clue to underlying issues with cholesterol metabolism, often pointing back to liver health. They're more common in individuals with high blood cholesterol levels, and while they can affect anyone, they are particularly prevalent in those with existing liver damage or dysfunction. Sign 5. Pressure on the right side of abdomen. Consistent pressure or discomfort on the right side of your abdomen, just below the rib cage, is not the occasional discomfort caused by eating too much or too quickly. It's a persistent sensation that may worsen after meals. This is where your liver is located, and feeling pressure here might be a definite indication that your liver is in difficulty. This pressure or discomfort can be caused by the liver becoming enlarged or inflamed, which is often linked with liver diseases such as hepatitis, fatty liver disease, or liver cirrhosis. When the liver enlarges, it can press against other organs and the ribcage, causing a feeling of pressure or fullness in the right upper abdomen. Furthermore, an inflamed liver can affect the smooth flow of bile, a digestive fluid produced by the liver to break down fats. A disruption in bile flow can lead bile acids to accumulate in the liver and gastrointestinal tract, causing discomfort and pressure. This symptom is particularly problematic when it is combined with other signs of liver damage, such as jaundice, changes in stool color, or unexplained fatigue. It's a clear indication that your liver may be struggling and needs attention. Sign number 6. Unusual bruising or bleeding. Have you noticed that little cuts seem to bleed more or take longer to cease, or they bruise easier than you before? While bruises and cuts happen to everyone occasionally, it can be cause for worry if they occur more frequently, or if your body reacts differently to them. This isn't just about the occasional bump or scratch. It's a noticeable change in your body's capacity to control bleeding and heal, which may indicate more serious problems. This change can be linked to liver function. The production of the proteins required for blood clotting depends heavily on the liver. The liver's capacity to create these clotting factors decreases when liver health is weakened, as seen in conditions like liver fibrosis, cirrhosis, or chronic liver disease. This reduction can lead to more frequent bruising and prolonged bleeding times, even from minor injuries. Moreover, liver injury can disrupt the body's platelet balance, which helps stop bleeding. A damaged liver may be unable to adequately regulate platelet production, resulting in a drop in platelet count, which adds to bleeding and bruising issues. Sign number 7. Persistent itching. Have you ever experienced an itchy skin that refuses to go away despite your best efforts at scratching? This itching is not like a rash or a mosquito bite. It's deep and persistent, and it doesn't go away no matter what topical lotions or creams you apply. Because its source isn't always obvious, this kind of itch can be very annoying. Persistent itching, medically known as pruritus, might be an indication of liver damage. Accumulation of bile salts in the bloodstream can occur when the liver is not functioning effectively, as occurs in conditions like fatty liver disease, hepatitis, or cirrhosis. The liver produces bile salts, which aid digestion. They can cause persistent itching when they build up on the skin. The itching can spread to any part of the body, but it generally appears most noticeably on the hands and feet. It can be worse at night, making it difficult to sleep, and other symptoms of liver disease, like jaundice or black urine, may also be present. If you are experiencing unexplained, persistent itching, it's crucial to treat it as more than just a skin problem. Apparently, your body is trying to tell you that something is wrong with your liver. Sign 8. Spider angiomas. Now let's talk about a visual clue that your liver might not be in the best shape called spider angiomas. Discovering minute blood vessels resembling spiders that are just beneath your skin's surface. These veins differ from the common varicose or spider veins that may develop with advanced age or standing for long periods. Spider angiomas are distinguished by a central red area from which little blood vessels spread, resembling a spider's web. Spider angiomas are linked to liver function. They usually appear when the liver is struggling, like in cases of cirrhosis or chronic liver disease, and is unable to adequately metabolize hormones, including estrogen. Sign number 9. Loss of appetite and weight loss. Have you observed a sudden loss of interest in previously enjoyed meals and unexpected weight reduction? This isn't about deciding to eat less or attempting to lose weight, but it's when your appetite decreases for no apparent reason and weights begin to slide off without effort. While this may appear to be a positive alteration, it can also be an indication of liver damage. A healthy liver serves an important function in digestion and metabolism. When it's not working properly, due to illnesses like hepatitis, fatty liver disease, or liver cirrhosis, it can cause metabolic disruptions that influence your appetite and your body's capacity to use nutrients efficiently. This can cause a severe lack of appetite and, over time, noticeable weight loss that is unrelated to changes in food or activity habits. Furthermore, liver problems can produce nausea and changes in taste preferences, which lead to a decreased appetite. This combination of reduced calorie intake and the body's inefficiency in food absorption might cause you to lose weight suddenly, perhaps leading to malnutrition and muscle wasting in severe cases. Sign number 10. Mental confusion and difficulty concentrating. Lastly, let's talk about a less obvious but still very important sign of liver damage. Changes in mental function, such as having trouble focusing, being confused, or having a foggy brain. At first look, these signs may not seem to have anything to do with liver health, but they can be signs of a serious condition called hepatic encephalopathy. Hepatic encephalopathy occurs when the liver cannot properly remove toxins from the blood, allowing them build up and affect brain function. On a mild level, this can cause forgetfulness and confusion. This can lead to a range of cognitive issues, from mild confusion and forgetfulness to severe changes in personality, mood swings, and even coma in advanced stages. Your liver is crying for help. It's crucial to remember that our liver's health is paramount for our overall well-being. Spotting these signs early on is vital in preventing severe liver damage. To safeguard your liver and reduce the risk of damage, consider adopting several key lifestyle changes. Maintain a balanced diet rich in fruits, vegetables, and lean proteins. Limit alcohol consumption. Engage in regular physical activity to manage weight. Avoid exposure to harmful toxins. Practice safe sex to prevent viral hepatitis. Consider vaccination against hepatitis A and B if at risk. Use medications responsibly, including over-the-counter drugs and supplements. And undergo regular health checkups that include liver function tests. Remember, these tips are preventative measures to support liver health and do not replace the advice of medical professionals. If you suspect liver issues, reaching out to a healthcare specialist is crucial. It's important to note that this video serves an informational and educational purpose only. If you identify with any of these symptoms, consulting a healthcare professional for accurate diagnosis and treatment is essential. For more insightful health content, make sure to subscribe to our channel. Stay informed, stay healthy, and remember, taking proactive steps today can lead to a healthier tomorrow.